And late today, our chief medical correspondent, Dr. John LaPook, spoke with the head of the CDC, Dr. Tom Frieden.
Are the conditions on Miami Beach different, harder than, say, in Wynwood?
Miami Beach is going to be a particularly challenging area. The high-rise buildings means you can't apply aerial spraying in the same way. Also, the windy conditions make it harder to apply some of the larvicide and adulticide products. On the other hand, you have more cement and pools that are chlorinated.
As CDC director, what keeps you up at night about this whole Zika outbreak?
I worry that it'll be difficult to stop transmission once it started in neighborhoods around the U.S. I'm deeply concerned about Puerto Rico, and I'm concerned that we won't have the resources we need to have a robust response, come up with better ways to find the virus and better ways to get rid of the mosquito.
John, you've been covering Zika for us since the outbreak in Brazil. What worries you the most?
Scott, I'm worried about all the stuff we don't know. I mean, you have a place like Florida, very well funded, a lot of experience fighting mosquitoes. They're throwing the kitchen sink at this, and still they're not sure that they can get it under control. What's going to happen in places like along the Gulf Coast, where it's likely there will be another outbreak? Little towns, maybe not as well funded. Are they going to even know that they have somebody there who's infected and that the local mosquitoes are infected? And if so, are they going to have the resources to be able to control the mosquitoes? And then I worry about things like the blood supply. Okay, they're testing in Puerto Rico and in Florida, but what about other places? Is there going to be a gap between when people in other places in the United States get infected and when we find out they're infected? And in that mischievous period, you could potentially have somebody without any symptoms, 8 in 10 people have no symptoms, who then donates blood. So this is the very first virus, as far as we know, that's both mosquito-borne and sexually transmitted. So many things we're learning every day.
Dr. John LaPook, thanks very much.